Welcome to the Veterinary Blueprint Podcast, brought to you by Butler Vet Insurance, hosted by Bill Butler. The Veterinary Blueprint Podcast is for veterinarians and practice managers who are looking to learn about working on their practice instead of in their practice. Each episode, we will bring you successful, proven blueprints from others both inside and outside the veterinary industry. Welcome to today's episode.
I'm your host, Bill Butler, and today we're joined by Dr. Kenneth Pierce, a board-certified veterinary ophthalmologist and the founder of Vespicon. With over 15 years' experience in the veterinary industry, Dr. Pierce has dedicated his career to advancing specialty veterinary medicine and improving access to expert consultations. Dr. Pierce, welcome to the Veterinary Blueprints podcast.
Thank you. Thank you for having me, Bill.
Yeah. So I'm glad to have you. And, we had connected with your team, and I ran into your team members down in at VMX, and thought that it would be great to have you on the podcast with what Vespicon has going on and just your journey as not only a veterinarian, a specialty veterinarian, but as an entrepreneur and some of the things that you've done in your career. So, why don't you give us a little background on your veterinary career and how you wound up where you are now?
Sure thing. So I'm originally from New Orleans, growing up as a, city boy, caught frogs and lizards in the backyard, and my parents never let me have a dog, but knew I wanted to be a doctor growing up, but didn't know what. And sat down, my cousin actually sat me down around high school time frame, was like, let's really consider your career, and why don't you look into veterinary medicine? So got connected with one of the veterinarians, the only African American veterinarian in the state of New Orleans, or city of New Orleans at the time, which was George Robinson. Spent some time with him, and then knew I wanted to get out of New Orleans for school, so went to Tuskegee for undergrad because they also had a vet school there, but majored in animal science, did well. Resident of the state of Louisiana, and in-state tuition drew me back to LSU for vet school. So was in LSU, did great there, and during my third year, right before we started clinics, the neurology and ophthalmology class were combined, and I knew that I wanted to specialize. And at the time, neurology and cardiology were actually number 1 and 2 respectively of what I would go into, until ophthalmology came in. And the language, the disease processes, the surgery and medicine aspect of it, and the variety of species that are available to you as an ophthalmologist, like, just was mind-blowing to me. And I was like, that's the career path that I want to follow. So I geared my clinical year and externships and such towards places where there was ophthalmologists, and then kind of went through the entire process of internship, specialty internship, residency, and so forth. So that's what brought me to ophthalmology there.
So, Pat, I think, and I've, in speaking with veterinarians, there's things that click with specific veterinarians for a variety of reasons. And, you gravitate towards what that is. And for you, it was ophthalmology. Yeah,
it was blatant, like the lights went on. It was just so easy. So yeah, I knew it. That was it.
So,
which is great because, people don't like eyes, so that's good job security for me too. So.
Well, that is good. And, if there's something I know about my animals, they like to either poke their eyes or run into stuff or, whatever. So, some of my own issues. And so, for you, what's driven you over the course of your career, and what drives you and what you're doing now with Vespicon?
Yeah. So I think obviously one of the main things that drives me is just the love of my profession and my career. So coming to work, seeing eye cases, seeing the impact that I have on not only animals, but on clients, on the pet parents, turning an eye around that looks like the colors of the rainbow to and a non-functional color of the rainbow eye to an eye that is back to normal, like, is always rewarding. And then throughout the years, so I always at least try to have some kind of plan. I think I either was raised or just kind of learned over time that you got to at least have a loose plan and I tell my nurses, be like water. everything
Yeah.
changes on a daily basis, on an hourly basis. But if you're able to adapt, be comfortable with adapting, then things come easy or can come easier. So I knew coming out of my residency that I wanted to at least start in academics, but eventually probably get into private practice and then figure out life from there. Didn't have a major interest right away to own my own business, but was open to the opportunity. So actually, after my residency at Michigan State, I was faculty at LSU School of Veterinary Medicine for a little over like a year and a half, and then I went to private practice in New Jersey. So I was out in New Jersey for over 5 years, then moved to Dallas,
Just
and
like
then
just like New Orleans and Louisiana, New Jersey, it's like they're brothers and
exactly
sisters, right?
right by the bayou, right by the shore in New
That's right.
Jersey. Very simple. Uh, but then, around 2020, so right in the heart of the pandemic, I was at the time I was transitioning out of my job in Dallas in April, and came upon an opportunity of bringing my specialty to a region of the United States that never had permanent ophthalmologist, which was in Shreveport, Louisiana. Uh, and so I started Veterinary Vision Center, and from all years of traveling around and seeing how much advice and access provides empowerment, comfortability, uh, and just the educational
Yeah.
aspect of to veterinarians, as well as just the impact on clients and their pets. Um, I figured that I need to see what I can do as just an individual, as a specialist, to bridge that gap for veterinarians across the nation, because of the fact around that time, shortly after maybe a year and a half of being in Shreveport, there was an oncologist, another actually LSU graduate. She graduated 2 years before me, Amanda Beck, who was working in the same building as I set up Veterinary Vision Center. But she took a position out in Florida. So now I was the only specialist in all of northern Louisiana, East Texas, and southern Arkansas. And again, seeing the veterinarians do their level best, we're trying to manage all these different cases, all these different disease processes, and not having access to, a comprehensive network of specialists is what how Vespicon came about.
Yeah.
Um,
And I think
and
like in the animal health space, and correct me if I'm wrong, it's a little bit like a food desert, right? Where you live in the inner city and there's no access to, vegetables, and you're buying your groceries from a 7-Eleven or whatever, right? I mean, we have friends that live in inner city Minneapolis here, and it's like, once a month, just because of where they live, they don't own a car. My wife will pick up a friend and bring her to Costco because it's easier to do it that way. And so,
exactly.
unfortunately, in the animal health world, it's not like you go to your hospital and you see your general practitioner, and then they say, well, here's a referral or a consult to go see, the ophthalmologist or the oncologist or gastro or podiatry 3 doors down. I get my healthcare at the VA.
Correct.
Everything's under one roof. And if you're
Correct.
a pet parent, if you own an animal and you want to get more higher level of care, and it's not that veterinarians don't provide good care, it's just you can't know everything, right? I mean, that's why they're specialists. And I think, and correct me if I'm wrong, this kind of gets to the question, is like a lot of board certified, cardiologists, ophthalmologists, a lot of them wind up in academia. So you're in academia, you're teaching, you're writing papers and stuff for veterinarians, but you're not out in the community actually providing care. So it like you were covering a huge area as the only specialist for a specific area.
Yeah. So that is the academic population is it is small from a overall numbers of specialists that are in academia, and there's a huge attraction in the industry right now to try to get specialists back to academia, especially with all the new vet schools that are
Sure.
opening. And obviously, they have a pretty wide net as far as area of service that they provide. But even if you are like, obviously, the majority of specialists are in metropolitan areas within the
Yeah.
nation, but a lot of the nation is not a metropolitan area.
No.
So that's a large net that they have to cast. And then the other problem that we're seeing in the industry with specialists or access to specialists is even in those metropolitan areas, it may take several weeks before you can get your pet into the specialist. So whatever's going on with your pet today may be totally different 3 weeks later, for the worse or for the better, right? Hopefully for the
Yeah.
better. Um, so that is also kind of the problem that we currently have within the industry, and how Vespicon helps to solve that.
So why
Yeah.
don't you describe? So you mentioned, we mentioned you founded Vespicon, and what is Vespicon as a business? So you got the entrepreneurial bug and said, hey, I see a need for access to care. What does that look like? And you founded Vespicon. So what is Vespicon, and how does it
Yeah.
work?
Yeah. So Vespicon is your veterinarians or your veterinary hospitals' more personal, comprehensive concierge network of veterinary specialists that they have access
Mm-hmm.
to 24/7 for unlimited consultation support as a member. And basically, what that means is that for that pet parent, they could go to their veterinarian, they can, discuss they can present their animal to them. The veterinarian can go and talk with a specialist because they're a member, get all the kind of specialist advice on how to manage that
Case. Yep.
pet uh, at no major cost to the client. And ideally, our business model is they don't even charge the client for that consultation, because that sometimes can be a barrier to use, because the client on the budget is going to tell the vet no, or sometimes in the heat of the moment as human beings, it's hard for us to say, oh, I need to go talk to somebody and I'm going to charge you for it. And this is what we're going to do, or what have you. The hospital has a subscription. The doctors use us unlimited. They get the knowledge, which will help that pet as well as future pets to come. They are now the acting specialists that can do everything in house and generate at least more revenue, more
Yeah.
education, have better patient outcomes, at least locally. Or we help them kind of manage that case until they can go to that specialty hospital for, say, a diagnostic procedure or diagnostic
Sure.
test, and the case doesn't fall apart in the interim. And we're also a concierge referral service. So we take that pain point also off of the veterinary hospital by being members with us. Whenever a case does need to be referred, they get back to practicing and staying busy, because I know they're busy already. And we just help book that referral for them.
So, in essence, for me as a lay veterinarian out there practicing, Bill's vet practice, and I want to sign up with Vespicon. I sign up with Vespicon to get access to your stable, so to speak, of
Hmm.
experts or board
Hmm.
certified X or whatever in an area that I've got a question on for a specific case. And then I get to use that advice to back me up and say, hey, I think I could do this or this with this case. What could have the best outcome? I just need a sounding board for this heart murmur or this eye issue, or I've got 2 treatment protocols I can do for oncology. Which one's the best one?
Exactly. So what makes us different and what sets us apart is that it's a more personal approach, right? Previous Our competitors are either you get a report or something's just over the phone
Mm-hmm.
or what have you. You don't really know who you're talking to, as well as you get different people different times there. We are recorded video consultation service with one or multiple specialists at a
Okay.
time. And we cover everything for large, small, and exotics, and as well as some additional and ancillary services. So you get that recording for your records. We are with you, whether it's a recheck, so that same case kind of follow through. You also have the ability to just have topic discussions with us. It doesn't necessarily have to be about a case. It's just you now have access to this
You've got a bigger
cardiologist and a
team.
neurologist that you never had.
Yeah.
Exactly. And then we also provide more too. We provide some teleradiology services. We provide CE. We actually are rolling out our business admin arm of Vespicon, where we already have a veterinary social worker as well as
Oh, wow.
veterinary. We've partnered with veterinary leadership coaching, which does practice and business leadership within the hospital, as well as we have some others that are currently finalizing our negotiations to round out our business admin arm. But pretty much we are that kind of firm of all types of support for DVMs, for the admin, as well as, the nursing team.
Wow. So it sounds like you've made some pretty bold moves in your veterinary career, moves across the country, doing different things. For veterinarians out there looking to make some bold moves in their career, their journey as a veterinarian, what advice would you have for them?
Yeah, so I would definitely say, and it's probably stuff that they've already heard, but definitely doing your research and really, figuring out, what's going to potentially set you apart, what is worth your time and your love. Because obviously, if you're making whatever pivot or whatever business move, there's going to be some
Yeah.
labor of love associated with it, some sacrifice. So making sure that that is appropriate for you, for your family, what y'all want to do. And as long as it's an investment in yourself, I don't think you can never go wrong with investing in
Yeah.
yourself and improving that. And I think if you uh, do all that, make sure everything's in a row, take that leap of faith, and don't be scared. If it fails, no worries. You will learn along
Yeah.
the way for the next best thing. So just know that if it does fail, um, it's not a problem. We all have it in our life, and we learn from it. So.
Stay with us. We'll be right back.
This episode of the Veterinary Blueprint Podcast is sponsored by Butler Vet Insurance. Being an insurance agent at Butler Vet Insurance, I've seen firsthand the difficulties veterinarians face insuring their practices. But do you know that we wrote the book on veterinary insurance? It's called Protecting Your Veterinary Practice: Insider Insurance Secrets Every Veterinarian Must Know. It's not just a book, it's a comprehensive guide that speaks to the unique challenges and insurance solutions for the veterinary community. With over 20 years' experience, from cyber liability to business auto and workers' compensation, our aim at Butler Vet Insurance is to reduce the stress of insurance for those dedicated to animal care. If you're a veterinary practice owner or manager and looking for some guidance on your insurance, follow our insurance blueprint. Discover the Butler Vet Insurance difference. And together, let's put the pieces of the puzzle together. Butler Vet Insurance, reducing the stress of insurance. What's one of the biggest lessons you've learned along the way? You've worked at practices, you worked at academia, you started your own practice, you launched a separate company providing services to veterinary practices in addition to running your own. We were chatting before the call, you're in surgery today, you had jury duty this week, you had all this stuff going on. And so how do how do you balance those things as a business owner and leader and leading your team and all those things? How do you balance that?
Yeah, you have to be like water for sure.
Yeah.
I definitely like that philosophy as far as just being amenable, but also kind of having your boundaries, right? So obviously you got to protect your time. Time management is super important.
Yep.
Even in your off time of work, like time management, you got to take care of yourself, take care of the ones that are around you, your loved ones, and so forth, and then and the your business or businesses. Um, but every day is something new. People are different, from one client to the next or
Yeah.
whatever. And probably the overall biggest thing I would say is for anyone is just communication. Make sure you're effectively communicating with whoever you're talking to, whether it's the most simplest thing or the most complex thing. Clarity of communication will save you in the long run.
Oh,
So,
absolutely. I want to go back to something you said about investment in yourself. And I really like a quote from Beyonce. Beyonce said, "I don't often gamble, but when I do, always bet on myself." And so,
yeah.
like it goes to what you said about, being willing to fail, understanding that, a lot of times you didn't say this specifically, but I think it was probably what you meant. Like a lot of times you learn the most lessons from failure, not success. And saw a Josh Brolin quote saying, I didn't learn anything from success. I learned everything from failure. And I may be
Yeah.
wrong with that quote, but where did you invest in yourself over the course of the last, 5 years as you were leading up, opening your own practice and leading up to starting Vespicon? What investments did you make in yourself that you look back on now and go, yeah, that was really a good move to do?
Yeah, I think just over the years, again, kind of starting from academics and then going into practice, paying attention to kind of the business aspect of it. So, you know, there was when I was at, for example, when I was at LSU or in undergrad, really didn't take business
Mm-hmm.
courses or the business courses in vet school were like, I remember one specifically,
Yeah.
right, that we had. So business acumen was real low coming out of vet school for me. And it wasn't something that I was taught from my family growing up. But being open, being receptive, listening, paying attention, learning along the way, um, was I think kind of the subtle investments in myself over time, and then just kind of figuring out and fig- planning out and figuring out what was going to be what's the long-term goal, like where do I see myself in 10, 15 years, and then what steps do I need to do to get there. And that helped me with a little bit of direction of, all right, I'm going to start doing this, I'm going to start looking towards this. When the opportunity came about, of starting Veterinary Vision Center, it actually kind of started from just a simple question of if I would come out and do speaking engagement at 12 doctor GP practice um, in Shreveport, Louisiana. And so it was like, yeah, I can speak. And then I came into, well, would you do some consulting? And I was already doing
Sure.
consulting for the practice I was in New Jersey. So I was like,
Yeah,
yeah.
I can do that.
And then that divulged into,
You opening,
oh, I could easily set up
yeah, I
shop
can do
here.
this.
Yeah.
So
Yeah.
that's interesting. And you had mentioned twice, talked about your team and being like water. But at the end of the day, I think as entrepreneurs or business owners or veterinarians, if you say at veterinary career, I want to own my own practice. I've said this with other guests and I've done this with my practice, my business. If you have a vision of what you want it to look like, what color walls, how many exam rooms are there, and all of those things, if you kind of have that mental vision picture of yourself, what does it look like for Dr. Pierce to be practicing at your practice versus a different practice, and then you behave like water along the way and just kind of let the decisions make themselves. Yeah, this is a decision that will help me get closer to that goal. It makes those decisions a lot easier to make. Would you agree?
For sure. I would. I think, yeah, it definitely makes it a lot easier, a little less stressful. If you're rigid in your thoughts, it might get you there a lot faster. I mean,
Yeah.
definitely, if you got a plan and you execute, like by all means, you will definitely hit your goal faster. But,
But then if something doesn't work
things
out
might
right,
be
it
a little
derails
different.
you a lot faster too, right?
Exactly.
Yeah.
Exactly.
So have a really good plan. I'm not advocating not planning. Winston Churchill said, failing to plan is planning to fail. However, you got to be able to adapt that plan if something doesn't work out. And so, for you with VespaCon and everything that you have going on
Mhm.
there, what's the future for you? And, I talked about 5-10 year planning for you and your practice. I mean, you're growing a practice, you're growing VespaCon. How do you see being able to do both of those? It's probably not some sort of duality where it's one or the other. It's how do you do both?
I've actually cloned myself,
Oh, you
Bill. You're
have?
speaking to Dr. Pierce
Dang
2.0.
it.
No.
That's one of my
No,
favorite
so
movies
part
is
of it,
Multiplicity with Michael
yeah,
Keaton. That is an awesome movie.
yeah, it is a good movie. But part of the plan with Veterinary Vision Center was to eventually get an associate in here with me to help kind of take off some of the burden with managing two
Mm-hmm.
businesses. And as of October of last year, we hired our associate, Dr. Kelsey Bailey. So she has been working with me at Veterinary Vision Center, which is great. And as time goes on, then and as VespaCon continues to grow, my plan is to kind of shift uh, my focus a little bit
Sure.
towards VespaCon more, um,
But I think you also have a
but
good
also
team, right? So,
still
like, you didn't
exactly.
reach out to me about being on my podcast. Somebody from your team reached out to me from being on the podcast, and I didn't see you standing in the booth down in VMX. I ran into your team in the booth at VMX. So you've got a
Yeah,
good team behind you. That's kind of putting some wind in your sails, so you're not trying to do it all by yourself.
you 100% accurate about that. So along the way of all these travels and places, I've been fortunate to have some really key, smart
Yeah.
ladies,
Yep.
mainly,
That's all I've
uh,
met. So
around me, and they are efficient, they execute, they do their job, and it takes a lot of stress and burden off of me at
yeah.
times, the majority of the time. But yeah, so I've kept them. So you met Lauren Tufts, who's head of operations for VespaCon. She used to be my former
Oh
nurse,
wow. Okay.
yeah, in Veterinary Vision Center, and her husband is in the military. They got deployed to a different state, and so I told her, like, you're not going anywhere. This is
You're
what
too
I'm
good.
doing. You're gonna help
Yeah.
me. Yeah, you're gonna help me execute this thing. But yeah, so I can't do it without the team. And as like the future goes, there's definitely plans for expansion for
Yeah.
both of the businesses and expanding the teams as well. Like, um, Yeah.
there's a
No one person can
no,
do
there's
it.
a really good book out there called Who Not How, and it's thinking about who's going to do this stuff, not how am I going to do it. And if I think, how am I going to do all these things to grow my practice or grow my business, or I want to launch a side hustle just to see if I can get something going, whatever that might be. It's not really a how question. It's who's going to do the work, because I can't do all the stuff at Butler Vet Insurance and everything else. And so it's that helping you along the way versus that solo person at the top. A lot of times it looks like that solo person. It looks like Dr. Pierce is doing it all or Bill's doing it all, but it's really not.
No. But I'm okay with taking the credit. I'm just joking.
Sometimes that works out, as long
Yeah.
as you got to share the love. Well, I've really appreciated it. If you had one gold nugget piece of advice for our listeners out there, veterinarians who want to make a bold move, you chatted about it a little bit, but what's the one thing that you would recommend to them?
Sorry, I stuttered
No,
a little
that's
bit
okay.
because I went to my Vespicon brain, and one of the things that Vespicon does that is helpful for veterinarians is basically one of the things that I saw that was lacking somewhat in the industry is supporting
Yeah.
veterinarians, right? We do a lot with supporting the
Mm-hmm.
clients, with supporting our nursing staff, which is very
Yes.
important as an industry, but from a practice owner standpoint, supporting your doctors who are like your main money
Yep.
makers or whatever, sometimes kind of falls, and there's a lot of, deviant burnout and all this other stuff that goes on, which was also one of the things that kind of Vespicon broke the barrier for of if you're supporting your doctors with this team of experts, now they've got clinical
They're
support, they got
empowered.
clinical mentorship ready. Yep. They're gonna love their job. They're gonna love the fact that they have access and they're able to do more and have better outcomes. So that in itself for a hospital is like one of the main things you could do from a veterinarian standpoint is we've got you covered. Like you have
Support.
unlimited
Yeah.
access. Yeah.
Support. Well, that's a great piece of
Um,
advice. You were going to say something else. What was it going to be? I didn't want to cut you off. What was it?
yeah, I was just thinking just from someone who's again trying to make a bold move, um, do it.
Yeah.
Just do it. Yeah, that would be my short and simple.
As
Just do it. It's
as
worth it.
I was on the call with another insurance agent, a good friend of mine down in Texas, and we were chatting about I specialize in veterinarians. He specializes in agriculture, and we talked about burning the ships. And sometimes you've got to make a bold move, burn the ships, and say, okay, we're all in on X, whatever it is. And we're going to make this work. We're going to make it work, or we're not going to make it. It's going to fail, but it's going to fail spectacularly.
Yeah.
But
Yeah,
I'd
yeah,
rather
yeah.
have the fear of defeat. I wouldn't have the fear of failure needs to not stop me from doing it. It's that man in the arena quote about, I'd rather have the loss of failure than never having done the bold deeds.
Exactly.
So,
Exactly.
well, what's the best place for if somebody wanted to reach out to you and reach your team at Vespicon or reach out to you directly? How would they get a hold of you, Dr. Pierce?
Yeah, you can consult with us today at vespicon.com. If you have questions, there's a
Sure.
contact, or if you want to sign up, there's a sign up button right on there. We also on all social media, Facebook, LinkedIn, Instagram, and X at Vespicon. And that's VESPECON for Veterinary Specialty Consultants. It's actually an acronym for those three words
Vespicon.
altogether. So, yeah.
Well, we'll have that information in the show notes for those listening along. And thanks so much for joining us on this episode of the Veterinary Blueprints podcast, Dr. Pierce.
Thank you, Bill. Thank you for having me. And best of luck to everybody out there listening to this.
Absolutely. Well, as always, for those listening, please like, share, and review the podcast. It helps get our message out to veterinarians and practice managers looking to grow and spend time on their business instead of in it. Thanks for listening to this episode, and we look forward to seeing you soon.